All right, everybody, it's Dr. Jeff, Rhythmia Life Advancement Center, depression and how to deal with it. So, if you've been taking SSRIs, which are basically antidepressant medications, if you've been taking these for 10, 20, 30 years, what that means is that you've blunted your emotional process. And for some people, that's a necessary thing because they were suicidal, they were unable to work, they were unable to function in their life. So when people that have a history of antidepressant medication come to Rhythmia, they've tapered off these meds, they got 30 days free and clear of them at least, what happens is a lot of emotions will surface. And these emotions are historical because if you've been on meds for 10, 20, 30, 40 years, for your depression, you've had 10, 20, 30, or 40 years of not feeling these events that are upsetting or sad or traumatic or whatever. So what happens is these emotions surface, and then what happens is our brain gets involved and tries to interpret what they mean. Now, I don't know about you, but I'm 49 years old, and when I was about 8 years old, I'm not sure what my emotions meant then exactly. Okay? So there's some confusion about what I was feeling at the time. So if those emotions from my childhood are surfacing, and I'm in my 40s, and they're surfacing during a plant medicine ceremony, my brain is trying to make sense of it. Well, what does it mean? What does all this this emotional process signify for me? Well, we can make some general assumptions. We can say there's probably some anger there. There's probably some sadness. There's probably some fear. There might be some guilt. There's these emotions that are kind of like typical that happen if we've been abused or traumatized or neglected or abandoned or whatever. So I had a patient who did really well here for the week. Then they went home and they were still overwhelmed a bit. They were feeling sad. And I said, this process is still occurring. You've been on meds for 30 years, and you've tapped in to your amygdala, which is where your subconscious memories are stored, and you're letting these emotions surface and flow out of you. So let it happen. Let it happen. How do you deal with depression in the day-to-day? Now, I worked, as a therapist in LA for many years. And I only really saw, let's say maybe, I worked with very acute psychiatric people and people with trauma and people with addiction. People that I think are justified to have some depression, okay? And I can honestly say that I saw probably 3 people in 25 years that actually had what is diagnostically accurate for clinical depression. 3 people out of thousands. So what I mean by that is that depression is overdiagnosed. There's a lot of people that just say, okay, you know what, like I don't feel happy with my life, I'm depressed. You know what, you're not happy with your life because you're making bad decisions, because you have a trauma history, because you're in an environment that's trapping to you, and you don't feel safe. And those are all legit reasons to feel upset, right? You do not have clinical depression. Clinical depression means you can't get out of bed. You do not have any hygiene issues. You're not taking a shower. You're not brushing your teeth. You're not eating. You're thinking about suicide, but you're not doing it because you don't have any manic energy to do it. Okay, depression is a serious thing. And I've seen it 3 times legit in my whole career. So what I'm trying to get across, right, is that people are overdiagnosed with this disorder, with depression, and you're over-medicated, and you're given meds to just help you feel better, supposedly, whatever, right? With some people it works, and it is a help, and it is a little bit of an assistance, but most people it doesn't do anything. And you have to change to other antidepressant meds, and then change to anti-anxiety meds. You have to change to, you name it. I've had people, my practice, I had on average 7 to 13 meds on each person I worked with. And I was trying to figure out, why was this prescribed? How did this happen? And it's because the psychiatrist who was prescribing the meds, not me, I was just doing the med management. The psychiatrist was like trying to just like cover his ass to not have liability if they got suicidal, if they went to the psych hospital, or if they end up in a group home or a sober living or a rehab. That's what they're trying to do. Okay, so how do you deal with depression? Well, I'm going to give you one amazing tool on how to deal with this, all right? Get off your ass and go for a walk. Go work out, take your dog for a walk, clean the house, walk down the street, come back, don't take your car somewhere, go to the grocery store on your own. Okay, that's how you deal with depression. Because when you have physical activity going on and you feel depressed, the natural endorphins that you release in your body neurochemically will boost dopamine. And depression is related to a deficiency of dopamine. That's the biochemical side. Now there's a behavioral side of depression. If you're told that you're a worthless person, that you're no good, that you're not worth loving, and you believe these things, you have a history of trauma, there's this behavioral side, and that's the hardest part. That's the hard part. That's the part you need to work on with plant medicine and therapeutic intervention. But this neurochemical side, okay, this neurochemical side is easily resolved. Do some exercise. There's a huge study done. It's a very famous study. They had thousands of people in one group taking antidepressant medication and thousands of people matched with that group doing regular physical exercise 3 times a day. The results were the exact same. The benefits were the exact same for exercise. Okay, so there's 2-pronged approaches for this. And I always say this with addiction too. There's the neurochemical side of depression. There's the behavior. The behavioral side is something we can work on. Let's work on it. Get up, force yourself to do something. If you can't do it, okay, if you can't do it, you're too overwhelmed, then you can go to the medical side. You can get some assistance. You can get some meds temporarily. I'm not an advocate for meds. That's why I'm here at Rhythmia. I've been working with meds for, like I said, 25 years. I've seen not a lot of good outcomes from that. The best way to deal with depression is to get active. Force yourself. Take your dog for a walk. Sit and meditate. Do some yoga. Go for a surf. That's what I do. I have depression in my family. I was born with a low level of dopamine. I was able to measure this because I'm in the healthcare field. And I measured that my family and myself have a low level of dopamine. So I'm inclined to depressive symptoms. So I said, okay, cool. So I don't like being depressed. So I'm gonna go exercise. I'm gonna go surf and work out, do mixed martial arts, and like get myself motivated to do stuff, get a plan going. Am I gonna take antidepressant meds? No, because that leads to the blunting of my emotional process, the blunting of it. We want you to feel what's going on. If it's too much, if it's overwhelming, use meds as an assistance. Use them, but don't use them long term. Antidepressant medication is indicated in all the medical literature to be used for no longer than 18 months. How many of you guys have been on antidepressant meds for decades? Okay. The literature says SSRIs, antidepressant meds, no longer than 18 months, okay? I don't know how many people that are on them for 18 months. My patients were on them for years and years and years. You know what that's called? It's called lazy practitioners, number one. Number two, I'm afraid I'm gonna get sued if you become suicidal and then all of a sudden the judge asks me, what did I prescribe? And I said, oh, well, I prescribed yoga and meditation, and they didn't do it. So I'm sorry. The system of healthcare for mental health is broken. You guys know it. You're watching this video. You believe the same. We have to take back power over this system, right? We have to take it back. We have to demand services that actually provide healing. And what those things are, right, there's a whole array. Plant medicine is one of those things that I love, that I'm seeing every day work really well for people. Holistic practices, exercise, healthy eating, martial arts. If you feel insecure about anything going on in your life, go to a jiu-jitsu class and connect with the people in that class and be a white belt and learn the basic moves of what's going on in there. I guarantee you your depression will leave you. You'll be gone. It'll be gone. Not only depression, any issue you're dealing with psychologically will alleviate because you're getting empowered and you're becoming self-confident and you're learning to love yourself. Martial arts, and I'm on a tangent right now. Martial arts are probably one of the most healing physical activities you can possibly do. And you know what? They're for everyone. They're not for just some badass dude who's like gonna fight in the cage in MMA. They're for everybody. They're for children. They're for men. They're for women. They're for people with disabilities. There are people that have all kinds of situations going on. If you really want to change your vibe, your mood, go join a gym that does jiu-jitsu or tai chi or taekwondo or Muay Thai or boxing or any of these things that you see in your neighborhood or your area. Do those things because that is what depression is about. It's about blocking your self-confidence, your empowerment as a person. I want you to feel confident in who you are. I don't want you to have to use meds. Some people need them for a bit, 18 months at the max, right? Deal with depression by working on yourself and getting out of the mind frame that you have this negative. That's the way to do it, okay? Come to Rhythmia and try this out. I'll talk to you myself personally. If you have depression, you can't get over it, we'll have a session. We'll talk. We'll figure out some strategies for you in your neighborhood, okay? Right now, I got about 70 people doing plant medicine for the first time. There's probably 5 or 6 out of the 70 who've done it before, but 65 or 60 of these people up here right now, first time. They're all nervous. They're going to do fine. We're excited for them. We have a staff ready to support and provide the care they need. Guess how many of these people reported having depression on their intake? 90%. Okay, 90%. So you can do it. You can overcome your depression. You can get past it. You can deal with it. Take the steps necessary. Just trust in the process. Let people that know what they're doing help you. Don't go to some freaking crazy ass doctor who just wants to give you meds and like doesn't really give a shit about you. Okay, don't bother with that. We all know those guys, right? And those women, we know who they are, right? They're trying to survive. They got bills to pay. You know, they got all kinds of rent and student loans and liability and all kinds of stuff, you know. I'm not blaming them per se. It's the system they're in, right? The system they're in sucks, okay? The medical system that psychiatry and psychology is in sucks. So don't become a victim to the system. Change your life. Change your symptoms of depression. I can't wait to meet you. See you soon. Pura vida from Costa Rica. Dr. Jeff, Chief Medical Officer, Rhythmia Advancement Center.